Good day everyone. Today I will be discussing the chapter 40 of the book, which is the nursing care of the family when a child has a respiratory disorder. For a child with a respiratory disorder assessment, so respiratory illness can begin as early as a moment after birth if an unit has a difficulty initiating a first breath or establishing a regular respiration. So an infant who is having a difficult breathing because of the nasal congestions, or a child who cannot run with other children because of the shortness of breath may having complications from a respiratory system. So, respiratory illness ay nagsimula ito sa kapanganakan kung ang isang bagong kapanganak ay nahihirapang magsimula ng unang hininga o magtatag ng regular na pahinga. Rating an unit using an Apgar score can help to identify a newborn who may have experiencing the respiratory difficulty at his early stage. So, by using the Apgar score, mauni ang importante para may balaan kung naabay respiratory problem ang baby. Nursing assessment finding that true a child is developing trachypnea or restrictions may be first indications of a child worsening conditions. And next one, the nursing diagnosis established for children with the respiratory disorder focus both on alterations in mechanisms of breathing and emotional distress, such as the problem can create the ineffective airway clearance is a common diagnostic category used in this area. So the problem may be characterized through presentations such as infective absent, cough, nasal, flaring, excessive sputum, or adventitious breath sounds. So outcome identifications and planning. So we have here the expected outcomes and plan of the care will focus on supporting the child and family about their status and response treatment. And caregiver of children with the chronic respiratory conditions need to learn how to continue therapy at home. So, if a child is experiencing an acute respiratory problem, ang mga tagapag-alaga or caregiver ng mga bata ay may malalang conditions sa pahinga ay kailangan matutunan kung paano ipatuloy ang therapy sa bahay. So, parents also need to understand that their approaches to this program must be changed as their child grows. So, helping families plan, exercise, and learn to proper medications, administrations, and use techniques are important to our nursing activities. So, what is important independent nursing intervention should be used in caring for a child with respiratory dysfunction. So, next, implementations. Collaborative nursing interventions in the care of the child with respiratory dysfunctions include the suctioning to remove respiratory secretions, administrations of oxygens, and providing humidifications. Suctioning to remove our respiratory and expectorant therapy to help and maintain clear airway. So, various independent nursing interventions may be beneficial. First, the placing child in an upright positions to help the child cough more effectively and maintain the comfortable positions. Second, suctioning to remove nasal secretions. Third, providing an interesting game to teach a child the importance of strengthening chest muscles. Then the fourth, supporting a child and family through anxiety created when a child is not breathing normally. And lastly, teaching the parents of a child with a chronic respiratory dysfunction by basis of respiratory treatments such as precautions or chest physiotherapy techniques. And the next one, outcome evaluation. So, outcome evaluations and acute respiratory illness can be extremely frightening for as well as the child. Support, reassurance, and education are important components in successful home management. So expected outcomes of for a child with a chronic respiratory disease will change as they grow and develops and may be dependent on this diagnosis and prognosis of the illness. So anatomy and physiology of the respiratory system. Uh, we have um, we have been separated into two divisions. So the upper tract composed of the nose, paranasal sinuses, pharynx, larynx, and epiglottis, and lower tract composed of the bronchioles, and alveoli. So, the therapy systems is the network organs and tissues that helps you breathe. It includes your airways, lungs, and blood vessels. So the muscles that power your lungs are also part of the respiratory system. And we have here the inspirations, breathing in, and expirations, breathing out. So the inspiration, breathing in, the respiratory systems deliver warm and moistens air to the alveoli, transport oxygens across the alveolar membrane to hemoglobin-laden red blood cells, and allow the carbon dioxide to diffuse from red blood cells back into the alveoli. Within the expirations, breathing out, carbon dioxide filled air is discharged to the outside. So the process of the breathing in and out, the lungs and respiratory systems allow us to breathe. This bringing in oxygen into our bodies called inspirations or inhalations, and seeing carbon dioxide out. This exchange of oxygens and carbon dioxide is called respiration. Respiratory tract differences in children. So, because of the respiratory tract continues to mature during childhood, children several important differences in respiratory anatomy and physiology from the adult. So, an infant airways is shaped like a funnel with the narrowest portions all at the cricoid cartilage rather than the vocal cord as an adult. So, ang panloob ng diameter ng mga daanan ng hangin sa isang bata ay mas maliit. Ang anumang pamamaga o sagabal ay maaaring matudulot ng matinding pagkabalisa. In general, ang mga dadaanan ng hangin ng bata ay mas maliit, hindi gaanong matibay at mas madaling makabara. So, ang mga bata ay mayroon ding mas mataas na rate na pahinga kaysa sa mga matatanda na ginagawa silang mas madaling kapitan sa mga ahente ng hangin. Infants have large occiput when compared with an adult, which can obstruct the airway. So, children also have the higher respiratory rate than adults, making more susceptible agent in the ear. So, next, assessing respiratory illness in children includes it includes history taking, physical examinations, and possible laboratory testing. We need to know what is abnormal before we can assess that what is abnormal. So, the physical assessment, a child with a respiratory disorder includes a general is observing the infant or child. Is he or she interactive, consolable, limp, or pale. So when you see interactive, how alert or looking around, distracted, or interested in playing of the baby. So this is the followed by assessing the work of breathing. So what is child position? Does he or she appears anxious? Does the breathing seem fast or slow? Do you sign the respiratory distress such as restrictions, nasal flaring and grunting, or gasping for the birth? And now we have here the cough. So cough reflects in initiate by stimulations of the nerves of the respiratory tract mucosa by the presence of the dust, chemical, mucus, or implementations. So cough can also be a symptoms of underlying lung disease such as asthma or cystic fibrosis. And we have here the cough. So cough cough reflex is initiated by stimulations of the nerves of the respiratory tract mucosa by the presence of the dust, chemical, mucus, or inflammations. So proximal coughing, and when you see cough, proximal coughing involves frequent and violent coughing that can make it hard for the person to breathe. And coughing is automatic reflex that help your body get or extra mucus, bacteria, and other foreign substances. So coughing can also be a symptoms or underlying lung disease such as asthma or cystic fibrosis. And the next is tachypnea. Tachypnea is an increased respiratory rate. Often is the first indicator of respiratory distress in young children. So when you see tachypnea, as the breathing of children faster than 60 birth minutes by infant younger than 30 days of age, faster than 50 breath minutes by 2 to 12 months old, and faster than 40 breath minutes by 5 years. So the next retractions when a child must inspire more forcefully than normal to inflate their lungs because of an airway obstructions or stiff, non-compliant lungs. Intrapleural pressure is decreased to the point that intercostal space draw inward, creating retractions. So when you see retractions, child will appear to sink in just below the neck or under the breastbone with each breath. So the next, restlessness. So when a children or infant have a decreased oxygen in the body cells, they can become anxious and restless. So restlessness kapag ang mga bata or sanggol ay mababawasan ang oxygen in the body cells, ay maaari silang maging balisa at hindi mapakali. So be careful not to interpret the excessive movement of infant with the respiratory distress as a sign that they are improving. Next, the cyanosis is a bloating to the skin, can indicate hypoxia. So if a children have a low unoxygenated red blood cells and the count below of 5 gram and 100 ml, cyanosis may not be apparent because there are not enough unoxygenated red blood cells to give the artificial blood aids to bloating. And next, the clubbing finger. Children with the chronic respiratory illnesses can develop clubbing of the fingers or change in the angle between the fingernail and nail bed because of increased capillary growth in the fingertips. So, clubbing can also be benign hereditary conditions. In children, clubbing usually occurs with the cystic fibrosis or uncorrected cyanotic congenital heart disease. Next one, we have here the adventitious sounds. Normal breath sounds are reviewed in chapter 34. So pathologic conditions cause adventitious breath sounds is the extra or abnormal breathing sounds which can be heard on the lungs assessment in children with the respiratory disorder. So the vibrations produced as air is a first pass of a it also so the raunchy vibrations produce as air force past an obstruction such as the mucus in the nose or the pharynx. It is a causing the snoring sound. So the stridor, if the obstruction is the base of the tongue or the larynx, a harsher strident sounds on the inspiration. And chest diameter. When you say chest diameter with the coronary obstructions lung disease, children may be unable to exhale completely, thus allowing air to be chronically trapped in the lungs alveoli. So the next one, the laboratory test. It can be used to confirm or rule out the presence of the respiratory disorder and help to identify the cause and severity of the problem. And the pulse oximetry, it's a non-invasive techniques for estimating arterial oxygen saturation, either as a single measurement or the via continuous monitoring. So a pulse oximetry it is for the measurement. A sensor and photodetector are placed around the vascular bed, most often the finger for the child or the foot for an infant. And the next one is the nasorangeal culture. Can be provide valuable information about the microorganism causing a disease, and nose throat culture can be revealed only the organism present in the upper respiratory tract. So it is a test that examines samples of secretions from the uppermost part of the throat behind the nose to detect organism that can cause disease. Sputum analysis because they cannot trace sputum with the cough. Sputum collection is really feasible in children younger than skull age. So unless collected from an artificial airway or tracheostomy tube. So it is involved the analytic approach to investigate the cellular and acellular component expelled from patient's upper respiratory tract. See, in older children, teach them exactly what you want, a specimen of what they are coughing up, not just a clearing from the back of their throat. So then ask them to breathe in out and savor up. So the next diagnostic procedure. In addition to culture, several other diagnostic procedures are used to identify respiratory disorder in children. Also used with the adult with the modifications to account for the physical and development differences of children. And also the chest radiograph. Chest X-ray will show areas of infiltrations and consolidations in the lungs. If the foreign body is opaque, an X-ray study will show its location. So X-ray are more limited in infant than in older children because infant cannot take a breath and hold with instructed. So radiograph, just rewind 10 seconds, uses a very small dose of ionizing radiations to produce pictures of the inside of the chest. It is used to evaluate the lungs, heart, and chest wall, and may be used to help diagnose shortness of the breath, persistent cough, fever, chest pain, or injury. And Pulmonary function studies. So the next is the pulmonary function studies. So the process of ventilations of the baby or the work of breathing. So E, an inertial force must be overcome to change the speed and directions of the air when the lungs change from exhalations from inhalations. So B, an elastic force to help the lungs expand with inhalations. And C, the flow resistance or resistance to the movement of the air through by the bronchial tree that must be overcome. So, pulmonary function studies, it is measure how well your child can move air in out of your lungs, and also called the breathing test, will help your healthcare provider. It tells if your child has the lung disease. So how severe it can, on what medications may help. Flow resistance must be a minimum for the best ventilations. Children with the restrictive ventilatory disorder, such as a neuromuscular disorder, have a equal difficulty with inspirations and expirations. And we have here the health promotions and risk management. So several ways to promote respiratory health are available for parents and children. So uh, teach children as young as toddler to help avoid spreading colds by washing their hands, properly disposing of tissues, and blocking a cough by their shirt. And now the therapeutic techniques used in the treatment of respiratory illness in children. So the primary goals of the nursing interventions in the care of children with the respiratory disorder is to maintain or establish adequate oxygenations, ventilations, and hydrations. So respiratory conditions may contribute to dehydrations due to the inability to eat and drink due to fatigue. So obstructions or being obligate knows better. And the next is home treatment. So inner irritations of the respiratory tract causes the productions of large amount of mucus. The amount of those can become so great that the natural mechanism for clearing it is coughing and upward cilia actions are no longer adequate. So instilling saline or nose drops or using saline nasal spray can be effective at moistening and loosening dried mucus in the nose. So the next one, the humidifications. The humidifications commonly used in homes for symptomatic relief of many common respiratory illnesses add the moisture to room by emitting stream of the line droplets of water into the air. Either is a cold or warm meant to be entire room. Also, the humidifiers, humidifiers should not be used with the children with asthma because this can cause symptoms to worsen. And now, the inhalations devices. Different types of inhalations devices can be used to deliver medications to the lower respiratory tract. So nebulizer are mechanical devices that provide a stream of moistened air directly into the respiratory tract. So method, those inhaler with the valve holder chamber spacer are at least as equally effective as nebulizer in the delivery of medications and can be used with a mass of mouthpiece. So in that way, nebulizers serve as an important means for delivery of respiratory tract medications. Young children often resist medications administrations because of the need for mask over the face. So it is important to monitor the child's respiratory status frequently and watch for common side effects of bronchodilator such as tachycardia, nausea, and jeternitis. And now the coughing. Coughing, encouraging coughing rather than the suppress it in children because it is an effective method of raising mucus. So changing child positions and suggesting mild exercise or deep breathing are helpful techniques to coughing. So cough and cold preparations are not recommended. And now the coughing, encouraging coughing rather than the suppress it in children because it is an effective method of raising mucus. So changing child positions and suggested mild exercise or deep breathing are helpful techniques to initiate coughing. So cough and cold preparations are not recommended in children less than 6 years of age because of both lack of evidence of their effectiveness and their potential harmful side effects. So the mucus clearance devices can be used to aid in the removal of the mucus. This device looks like a small plastic pipe. These vibrations uh, help loosen mucus so that it can be moved up in the airway. So the most frequently used in the children who have cystic fibrosis or pneumonia to help remove mucus from the lungs. So we have here the three techniques are involved with the chest cytotherapy to further loosen mucus for expectoration. So we have here the postural, drainage, and the precaution. So vibrations common postural drainage positions for the infant are shown in figure 40.8. So the vibration is done by pressing vibrating hands against the child's chest during exhalation. So the precautions is it mechanically loosen and help move to tenacious secretions upward. So if a child is going to need continue CPT at home, one or both parents will need to we need to learn the techniques before their child is discharged so it that can be the continue the therapy at home. So the next is the therapy to improve oxygenation. So improving oxygenation almost automatically relieves breathing and distress. So the oxygen's administrations elevate the arterial oxygens in saturation level by supplying more oxygen to red blood cells. So when you oxygens like any drugs require carefully administrations and follow-up assessment. So for this reason, oxygen should not be given in high concentrations for long period without careful monitoring. Next is pharmacologic therapy. Children experience difficulty with exchange of air when the airway become obstructed because of unusable mucus production. So the bronchitrations of implementations it will be help for infant baby. Next one is the pharmacologic therapy. Children experience difficulty with the exchange of air when the airways become obstructed because of unusual mucus production. So several drugs may be used in the children to reverse their processes. So nasal spray such as a normal saline can be administered for moistened and loosened nasal secretions. When you see pharmacology is a science that studies effect of the drugs on the body. And then the pharmacological therapy deals with the making and use of the drugs and especially the effect them on the body. So then the metered-dose inhaler. Metered-dose inhaler is a handheld device that provides a route for medications administrations directly to the respiratory tract. So the child inhales while depressing the trigger on the apparatus. So for successful use, children needs to follow 5 general rules. So shake the shake the canister, exhale deeply, activate the inhaler, and place it in their mouth as they begin to inhale. Take a long, slow of inhalations and hold the breath for 5 to 15 seconds. And the next one is incentive experimetry. So our device that encourage children to inhale deeply to accelerate the lungs, fuel or to move mucus. So children needs to instructions on how to use type of device because their first impression is that they should blow out against the mouthpiece rather than inhale. So, breathing techniques. Some children need to exercise prescribed to help them better inflate or more fully empty alveoli. So, blowing the piece of cotton or the plastic ball across the table, blowing through the straw or blowing out with the breathing techniques. Some children need to exercise prescribed to help them better inflate or more fully in the alveoli. So, the blowing a piece of the cotton or the plastic balls across the table. So, blowing through the straw or blowing out with the lips pursued are effective techniques for better empty alveoli. So, for the best result, make this activity a game or contest rather than exercise. So, endotracheal intubations. It means of securing an airway in a child who is unable to oxygenate and ventilate on his or her own. So, the techniques first discussed in chapter 26 is the method used for newborn resuscitation. So, it is the endotracheal intubations is a medical procedures in which when a tube is placed into the windpipe, so through the mouth or nose. So tracheostomy is an opening into the trachea to create an artificial airway. It most often performed in infant or require prolonged ventilations. So this tube is placed into the hole to keep it open the breathing. So the procedure to create this airway is called tracheotomy. So the tracheotomy tube can come in different length and diameter in figure 40.13. So parents' educations for uh, tracheostomy take care. The parents educate for tracheostomy care should start prior to placement and resist prior to discharge. So suctioning techniques. Suctioning techniques most tracheotomy tube used with the children today are plastics and have an inflatable cuff that help to prevent dislodgement. So suctioning may be needed if secretions are seen on heard. So use stirring techniques to prevent introductions microorganism. So although clean techniques is a general thought to caregiver from home suctioning. Then use stirring techniques to prevent introducing microorganism. Although clean techniques is generally taught to caregiver for home suctioning. So tracheostomy tube are held in place by cloth ties that fasten at the back of the child's neck. So cautions parents not to give their child a small toy that could it fit and along in the tube and cause obstruction. So second, to keep the use of spray such as the room freshener to minimum so they won't irritating to expose trachea. So the third one is to keep the cold air from blowing against the tracheostomy opening because this can be cause tracheal spasm. So the next one to inspect stop tools to be certain they are intact and not sheets. And the last one is to supervise place other children so they can don't place anything in the tube. Stay with the child in the bathtub to be certain water does not splash into the tube. And now the assisted ventilations. Now, assisted ventilations, a positive pressure machines deliver the moistures or nebulized air or oxygen to the lungs under the enough pressure. So, non-invasive ventilations is the preferred method of ventilations with the children. So, infant need nasogastric tube inserted to prevent stomach distensions from their entering the esophagus with the ventilator in place. And, and the lungs transplantation is a possibility for children with a chronic respiratory illness such as cystic fibrosis. So the transplant may involve a single lungs or both lungs. So the donor lungs can be from live donor or the cadaver. And the last one is the transplanted lungs in place. So children may need to have CPT or use portable respiratory device daily to help mobilize secretions resulting from loss of nerve innervations or reactions to accumulating mucus in transplant. So disorder of the upper respiratory tract, warm humidifies and filter the air that enter of the body. So figure 40.15. So the congenital malformations of respiratory structures also cause some upper respiratory tract disorder. So So the next one is tunal atresia. So it is a congenital obstruction of posterior ears by an obstructing membrane or the bony growth, which is to prevent newborn from drawing in through the nose and down into the nasopharynx. So it can also be assessed by the holding the newborn, mouth closed, and then gently comprising first one nostril and then the other. So suggested if infants struggle to become cyanotic at feedings because they cannot suck and breathe through the mouth simultaneously. So the treatment for tubercular artesia is either local piercings of obstructing membrane or surgical removal of the bony growth. So chonal atresia, it is a narrowing or the blockage of the nasal passageway that result in difficulty breathing. So the blockage is due to the tissue or the bone in the nasal airway that was present at birth. So the pharyngitis is in infections and inflammations of the throat. It may be either bacterial or viral in origin. It may be occur as a result of the current allergy in which there are constant post-nasal discharge that result in throat irritations. So it's defined as an infections or irritations of the pharynx or tonsil. So the peak incidence occurs between 5 and 15 years of age in winter and spring. So if within incubator period of 2 to 5 days. So the viral pharyngitis, the causative agent of pharyngitis is usually the virus. So ang pinakaliwang sanhi na namamagang lalamunin ay isang infection sa viral. So, tulad ng sipon or flu. Ang namamagang lalamunin na dulot ng virus ay naglulutas sa sarili nitong straight throat o isang gaanong karaniwang uri ng sore throat na dulot ng bakterya ay nangangailangan ng paggamot gamit ang mga antibiotic upang maiwasan ang komplikasyon. So the next one is the epistaxis. What is a nosebleed in children? So a nosebleed in the bleeding from tissues inside the nose caused by broken blood vessels. So most nosebleed in children occurs in the front part of the nose close the nostril. So nosebleed are common in children. So nosebleed may also occur after strenuous exercise with a hemolytic disorder or may be associated with nasal polyps, sinusitis, or allergy rhinitis. Nosebleed can be frightened. The amount of the blood can be seen in generally out of the proportions to the seriousness of the bleeding. So apply the pressures to the cartilage on the sides of the nose with your finger about 10 minutes. The next is sinusitis. Sinusitis is an infection and inflammation of sinus cavities. So children with the bacterial sinusitis often have the preceding upper respiratory illness but have persistent or worsening symptoms of fever, nasal discharge, and cough that generally last for over 10 days. 10 days. So, treatment for acute bacterial sinusitis consists of analgesis for pain, antibiotic, the specific organisms involved. So, laryngitis is an inflammation of larynx, which result in brassy, hoarse voice sounds or inability to make audible voice sounds. So the next is congenital. So means that its infant laryngeal structure is weaker than normal, collapses more than usual in inspirations. So epiglottitis is an inflammation of epiglottis. It occurs most frequent in children from 2 to about 8 years of age. So it can be either bacterial or viral in origin. So epiglottitis in children. In children, signs and symptoms of epiglottitis may develop within the matters of hours, including fever, severe sore throat, and abnormal high-pitched sounds when breathing in stridor. So aspirations occurs most frequently in infant and toddler. So the series block blows abdominal chest may be used with children figure 40.17 and 40.18. So the aspirations when a child aspirate the foreign object such as the immediate reactions is a choking and hard for fall coughing. The first fall coughing. The next one is the bronchial obstructions. So the right main bronchus, it's a trachea and has the larger lumen than the left bronchus in children older than 2 years. So the alveolus obstructing portions. So the bronchial obstructions happens when the small items get stuck in child throat or upper airway and makes it hard to the child to breathe. So Next is disorder of the lower respiratory tract. So the structures of the lower respiratory tract are subject to injections by the same pathogens that attack the upper respiratory tract. So the next is influenza. So it involves inflammations and infections of the major airways. So it is caused by orthomisoviruses, virus, influenza type A, B, or C. Young children are the highest risk of complications from the flu, in particular children with the chronic health conditions. Next, the bronchitis. So one of the common illnesses affecting preschool and school-age children. Causative agents include the influenza virus, adenovirus, and mycoplasma pneumonia, among others. So, um, next one is bronchiolitis. So, inflammations and edema of the fine bronchioles and small bronchi, usually due to the viral illnesses. So, the infections occur most often in the winter and spring. So the most common lower respiratory illness in children younger than 2 years of age. So um the most common reasons for hospitalizations in infancy. Asthma is a chronic inflammatory disorder of the respiratory tract and the most common chronic illness in children. So asthma symptoms can be variable with each child with different trigger and clinical presentation. So the most children with asthma can be shown have allergy trigger. So ang isang outer irritant can include pollens, gases, and pollutions among others. So the viral respiratory illnesses are the common trigger for asthma exacerbations in children. So that will be all. Thank you.